So the goal of a vaccine is essentially to train your immune system on how to fight a virus. So what it does is it shows the immune system part of the virus. So there's many different types of vaccines, four different types that I want to talk about. The first is called a live attenuated. So it's a live strain of the virus, but it's attenuated or weakened so that it's not as potent. And you give the person the virus, the immune system recognizes it, learns how to fight it. The second is called an inactivated vaccine, where you basically have an inactivated version of the virus, so it can't actually make you sick. The third is recombinant, where a part of the virus is presented. So it doesn't have to be the entire virus, and it can't make you sick, but a part of the viral protein. So in the case of the COVID-19 vaccine, for example, the spike protein is presented to the immune system as a way to teach the immune system to fight that part of the virus. And then the fourth is called a toxoid vaccine, where you basically inject the toxin that's created from the virus. The efficacy or effectiveness of a vaccine depends on a number of different factors. The first is the body's immune system's response. So sometimes we have to have something called a booster, which is really reminding our immune system how to fight it again so that it doesn't get lazy and forget how to fight it, really boosting up the immune system again. Sometimes you can get waning of antibodies and immune responses. We see this with, vaccines such as the flu vaccine, whereas later in the flu season, you can have waning of, the immune response against the vaccines. So it's less likely to be effective. And then sometimes it depends on the vaccine and not as much on the host response. We see this with viruses such as the flu virus, which tend to mutate rapidly and change. And so every year we have a different strain that we're dealing with. Vaccines are not only safe, they're life-saving. With any medication or intervention, there's always a small possibility of side effects, but the vaccines that are on the market have been thoroughly studied. And not only are they studied before they come to market, but they're actually studied once they've been put on the market in what's called post-marketing surveillance, where they're monitored for a long period of time. Data is continued to be collected as they're given to lots and lots of people. So even though there's a small risk, very, very, very small risk with any intervention, the benefit greatly outweighs the risk.